what it gets to is bowels and their dysfunction is what I was trying to get at. And for the first 20 years of my practice, I did exactly what these guidelines told me to do, which was push fiber, push fiber, push fiber, push fiber. And there was the fiber, and it's lowered to less colon cancer. And so I would promote that. I would talk about how important it was. I would say, okay, if you can't eat that much, supplement it with soluble fiber. And what I didn't realize was every time I was doing that, you were increasing their insulin, because that soluble fiber still has an insulin response, which I did not know of until I started experimenting. But there's been a couple of lectures that I've seen Dr. Westman give, and just talking about that is a real insulin response. And that's why playing the games with partial carbs versus or net carbs versus total carbs is a little dangerous. When you look at irritable bowel syndrome, though, that leads to the first thing people say is, Doc, I'm on this ketogenic diet and I'm constipated. You're like, okay, let's do constipation. So constipation is related to the bowel's ability to send a wave of muscle signals down a hose, essentially. So think of it as this wave that goes down the hose, and one set of muscles talks to the next wave of muscles, talks to the next wave of muscles. I'm going to give you some examples to just make sure you understand that. When you get constipation, the wave got broken. The wave is not moving, so now you're stuck. And then this little tiny wave comes along, but it runs into a big massive stool, and it can't send that wave through without a little help. So get them a stool softener helps, get them a drug that flushes water back into the bowel. Drinking, sometimes we flush water up from the bottom side, okay, called an enema. So all of those would work, but one of my first jobs, I was a farm kid, so I had no role models that were doctors. And so I said, well, I'm going to go work in a nursing home to see if I even like this field. And not sure how I made it through that, but it was a great learning curve. I took really good care of my teeth from then on, because my job for the first year was to make sure everybody's dentures were cleaned. But the second thing that happened was you had to track people's bowel movements. If they didn't have a bowel movement for a while, you had to make sure and help them. And one of the things, I was the nurse's aide, and so we would give a massage to our folks at night, just a back massage, and rub lotion on their back. But if they were on the bowel list, we also did something called abdominal massage. They used to, so I thought this was the strangest thing ever, went to the library and went to the books on nursing and said, what is abdominal massage, and why does it have anything to do with their bowels? Because nobody could tell me. They just said, they're on the bowel list, you need to rub their abdomen. And so the point of the trick was to actually push hard enough on their abdomen that you would push on the muscle, and you would push on the muscle and it would trigger a wave. Well, so I went from actually like just rubbing lotion on their abdomen to actually massaging their bowel, doing a true bowel massage with enough pressure, and it moved the stool along. I mean, that we had that switch to doing those in the morning. The point of this is that when you have constipation on a ketogenic diet, you are having troubles with the wave of the muscle getting all the way down to the rectum. So when you've got this problem, you used to solve this with fiber. So in a ketogenic diet, not only is the fiber associated with so many carbs at first that they get constipated, that if they did eat enough carbs to reach the fiber needs, they shove themselves out of ketosis. So in order to get your bowel back in shape, and I really mean that, it wasn't an accident that I told you that story about pushing on your abdomen enough to move the bowels. That's one way to just biohack your system when you have constipation. But the other way is that your bowel is used to being stretched to trigger that the wave to begin again. So if the wave passes to the next wave, you're perfect. Life doesn't tell you about constipation. But if the wave passes to the next wave and then runs into a large amount of stool, it will stop until it gets so stretched that then it starts to spasm and trigger. Well, that hurts, but that is a sign that your bowel also needs to be in better shape. So what's the answer? Okay, the best solutions I've had, because I've run into this, I've done this a couple different ways. This is my favorite way to solve it on a ketogenic diet as of right now. So chia seeds chia seeds are these little bitty seeds. They're kind of like tapioca that if you put them in fluid, they bind up and they get kind of gelatinous. So chia seeds, I have them take a tablespoon every hour, and they're dry chia seeds. So sometimes you kind of have to like chew it, swallow it down, and then you're gonna have to floss because they're gonna all get stuck in your teeth. But you do that every hour, and guess what? You're gonna add a little bit of chia seed to that bowel. It does not cause an insulin response, and it does cause swelling. And that is how your bowel has been working. If you are on a ketogenic diet and you haven't really struggled with constipation before, but now you do, it's almost always because the amount of fiber that you're taking in is lower. That decreased amount of fiber, it would stay in the bowel and your body would suck out all the carbs. So let's put chia seeds in, and this again, even if you have diverticulitis, I would still tell you to do this because you're going to take this with water. You're going to swell up this little mass of chia seeds, and it's going to be this gelatinous hose that comes through. You'll know when it comes out the other end. But you're going to do this every hour while you're awake, and then you're going to keep doing that the next day, and you're going to keep doing that the next day until you start having a couple of bowel movements that feel normal to you. Then you're going to back down to 1 tablespoon every 4 hours or 1 tablespoon every 3 hours. And you're going to do that for 3 or 4 days. And then you're going to back down to 1 tablespoon every 6 hours. And what you've done is you've put you've kind of reset the bowel so that you're not constipated. You did it without adding a whole bunch of carbs to your body. And you also are getting your bowel back in shape. It's, again, this muscle that passes on to the next one, that wave is really important for your system to increase the strength of those muscle fibers. And if you've been depending only on fiber to move those stools along, you're going to have a tough time with a ketogenic diet. I would contend that the harder patients to solve, because this lady said she got rid of her IBS, the harder patients to help are the ones who have massive diarrhea when they go on a ketogenic diet. They put all these fats in, and their bowel is so not ready for that. Again, when you put fats in your system, 2 major things have to happen. The pancreas needs to secrete some enzymes to break down the fats in a way that you can absorb them, kind of cuts them up. And your gallbladder needs to squirt out a bunch of bile. If you don't have a gallbladder, your liver needs to add a bunch of bile to the equation so that you can absorb these fats. That does not happen overnight if you've been on a low-carb diet. That will take you several days to even weeks to get the enzymes high enough for this high-fat diet. It will take you days to weeks to get your gallbladder back in shape. I mean, I've had people have gallbladder attacks because they were eating so much fat. And again, the gallbladder's a muscle, so the muscle has to squeeze every time you eat fat. And if you eat no fat for 10 years and your gallbladder's kind of like out of shape and full of scar tissue, and now you're asking it to really squeeze every day, that's like going to the gym and asking you to bench press 3 times your body weight every day. You're going to hurt yourself. So this is the part where if you haven't bought the book, I definitely want you to buy the book. That will go through some of the steps here, which is start your first week with removing all calories from liquids. Again, this means no sugar pop, no sweeteners in your drinks. Your drinks become a place that you do not get sweet tastes from. That's really hard, so that's why I have you start with that one. Just work on that one. Once you master it, once you do that every day for 7 days, then you start taking away carbs from the white stuff, the breads, the rice, the pasta, the potatoes, all that stuff. So those 2 things will naturally increase your fat just enough that you have to start waking up those fat receptors. The third thing that happens in a bowel that's got irritable bowel, so we've gone through the constipation. The diarrhea is very much related to how well the pancreas, the gallbladder, and the little cells, the acinar cells that absorb fat in the gut lining, if they're not awake, or if you've had a gastric bypass surgery, boy, oh boy, you find trouble. They have a tough time kind of waking up those cells to do their job. They've been not needed, so they're kind of dormant in like hibernation. To wake them up, it needs a little bit of energy. It's like you got to keep giving a little bit of fat. What will happen on the other end is you're going to have diarrhea. You're going to have stools that have oil in them. And that can be an alarming symptom to a doctor if they don't know that you've drastically changed your diet. If you're still having that problem by the end of week 2, then you're going to want to see your doctor. So be careful of that. Irritable bowel syndrome, I contend, is the bowel lining of your gut has become sick. Your bowel, there should be a slime layer that lines your bowels that kind of protects your food, the food bolus from the lining of the bowel. And this gets better with a ketogenic diet because of your immune system. This again has to do with decreasing the inflammation. You say, well, doc, how do you do that? You decrease the sugars, you increase the insulin. This makes it a lower Dr. Boz ratio. And as you look at a Dr. Boz ratio of 40 or less, that is a absolute correlation to the kind of recycling in the body called autophagy that would help with an irritable bowel syndrome. I don't think it would be a strong enough Dr. Boz ratio to help with somebody who's got severe cancer. You're going to want to be under the care of a doctor if you're doing that kind of intense treatment. But when you have irritable bowel syndrome, you're trying to reset the lining of this gut. By adding fat, by decreasing carbs, you are changing the chemistry in that biome so much that the bacteria that used to live there are almost all of them going to die off. And the ones that are kind of like, we've got two little people of our colony left, they are the ones that are going to start to flourish. You will see a significant shift of the biome in your gut just by being keto. That means they didn't add any supplements. They didn't add any, give me the new bacteria. I want a bacterial reset. And although there's some validity to some of that, even just going ketogenic dramatically changes how that biome looks and how it grows. Wow, that was a long section on guts.
Please subscribe to my channel. And don't forget to click the notification bell so you don't miss out on any new videos. Stay tuned.